Hello, everyone, and welcome to Ibi Speaks. My name is Ibi. This month of August, I thought to do a series on self-actualization. I started with Mr. Sonny Ibi. He talked about how to deal with setbacks. Last week, I had Nike Akerele D'Souza, and she talked about finding fulfillment in mid-career transitions. And so today, I will be talking about how to deal with your mental health, because I kind of like picture that, if you have to deal with setbacks, and if you have to find fulfillment in mid-career transitions, and transitions could be, anything, it could be, from relocating and, just generally moving from one career to another, or just even going from working to be a mom. We need to have a certain level of mental fortitude, or to have healthy mental health to be able to do that. So that's why I thought that it's going to be, very interesting to have a mental health specialist teach us how to look after our mental health as we actualize ourselves. I also thought that in actualizing ourselves, that we should also learn to also help other people actualize themselves. So in talking about mental health as well, we're going to learn about how to look after our mental health, and also how to help people who may need help. So I want to say thank you to everyone who's joined us today. I'm appreciative that you're here, and I thank you for giving me your time. And for those of you who are watching, oh my God, bad English. For those of us who are watching via YouTube, I want to say thank you for joining me as well. Now, thank you so much, Dr. Lasebikan, for being here today and for taking time out of your very busy schedule and at short notice, really, to be here. So I am very, very appreciative of it. Thank you very much. Thank you. So in talking about learning how to look after your mental health, I want to tell the audience a little bit about you. So you obtained your medical degree at the University of Ibadan and attended University of South Wales in the United Kingdom, where you bagged your master's in business psychology. You were a member of the West African College of Physicians, Faculty of Psychiatry, and associate member of the Chartered Institute of Personnel Management of Nigeria. You received training in management from the London Business School and the University of Washington. You've published peer-reviewed articles in reputable medical journals and conference presentations. You are a member of the American-based Academy of Organizational and Occupational Psychiatry. Thank you so much.
Thank you.
Yeah, so, I was just looking at your profile, and I saw that you were among the 150 health professionals who provided psychological first aid and social support to over 15,000 people who were affected by COVID-19 between May to December 2020. The word psychological first aid caught my attention. I know about, first aid, bandage, and plaster and all of that. But what does it mean to give psychological first aid?
Okay, so just like when there are disasters, natural disasters, floods and whatever, most of the time people look after the physical well-being of the person. So you are checking for if there are injuries, you want to help, but many times there are psychological, emotional injuries, which we should attend to initially, and we don't. So what psychological first aid does is that it tries to, help the person emotionally at that instant, and we've noticed that, it tends to reduce the psychological sequelae that people could develop later, weeks and months later, just because they received, the emotional care immediately after the trauma.
Really? So just like having the first aid or a bandage when someone has a cut, the psychological first aid goes a long way in helping to avert any form of trauma in future. Yeah. So, what are some
Okay,
of the
yes.
examples of psychological first aid?
Okay, so psychological first aid is a process. I mean,
Okay.
so immediately the trauma occurs, of course, you get there and then you want to be sure that the person is away from further danger. So if, for example, the person is, the house is got burnt, you want to separate the person from the area. You want to look for clothes that the person can wear immediately. In the case whereby the person is, the clothes got affected, you want to ask, do you want something to drink? Do you want something to eat? Do you want to talk about it? If the person doesn't want to talk, you allow them to be. You want to show some empathy. You want to be in their, place yourself in their shoes. You want to ask, is there anybody around that I can call? Do you have a relative that you can stay with? And that form of interaction with the person at that instant, where the person does not feel alone. It doesn't feel like no one cares. It doesn't feel like the world is over. That's form of care that the person receives at that instant, goes a long way in helping him deal with the emotional trauma when it starts coming, again. When it starts coming again, it helps the person, to knows that okay, somebody supported me the other time. With the funny thing is that when we provide such first aid, we don't leave it there and say, okay, you can go now. If we discover that at that instant the person is more likely to develop psychological trauma, psychological disorders rather, we can refer to a psychiatrist at that point. Whether we refer to a psychiatrist or not, we also check back. We could check back in 3 days. So your house got burnt, I look for a place for you to stay. So I want to know, are you all right now? Are you doing now? That kind of care reduces the potential of having depression later, post-traumatic stress disorder, and the rest.
So do we have that kind of system now in place in Lagos or in Nigeria in general?
All right. So during the COVID pandemic, the Lagos State actually formulated a group, a team that was doing that for COVID patients. So we were called the psychosocial team. Initially, when people got COVID, the results, the folks in the lab would just call you and say, hello, madam, your result is positive, you have COVID. And of course, you can imagine, the kind of trauma that the person goes through. So, but a few weeks after that, Lagos State said, no, this cannot work. So they called in psychiatrists, psychologists, counselors, to help in the process. So what we're doing is that, we are the ones that actually first inform people of their results, and we go about it, in a trained manner. So how to break the bad news, how to help the person through the news. It's funny that there are a few people who I met then who actually we still communicate occasionally up to now, because they were able to form a kind of bond with the person that broke the news, followed them through the process. Despite the fact that yes, we were getting care, physical care, there was someone who was also providing emotional care. And even after leaving the hospital, some of them still maintained the contact.
Fantastic. So that's very good. I hope and I pray that we're going to have that kind of structure, along several lines, in the mental health institutions, because I see that that kind of support really goes a long way,
It does.
especially maybe in schools and things like that.
It does.
Yeah. So that's very good to hear. And I was talking to one of your colleagues, I think was it yesterday or so, and he said that you set up an NGO, and I think that you once in a while provide presentations and talks in the NGO. And he says that we're just talking, and he says that the NGO is an initiative, and they are saddled with increasing awareness of mental health and psychological issues. And incidentally as well, or coincidentally as well, I was in contact with another fellow who just contacted me in LinkedIn, and he also is part of an organization in Port Harcourt, an NGO that helps to support people with mental health issues. And he's saying, which resonates with what your colleague said, that there seems to be a rise in mental health issues in Nigeria. Now, I know that, of course, I'm just a layperson, but just from studying and understanding, I know that there is several kinds of mental health situations. We have the schizophrenia, we have disorders, bipolar, we have eating disorders and psychosis and all of those kind of things. But then, like, you are in the forefront of the situation. So what exactly are the cases that we're seeing, in the increase of mental health situations in Nigeria?
Okay, so first, I would like to address that, using two dimensions.
Yeah.
First, indeed, there's an increase in mental illnesses, but there's also an increase in the awareness level. So years ago, people could be depressed and maybe just talk to their pastor. But now people are getting depressed and coming to the hospital. Now, people were having, so there's this awareness of mental health and mental health issues that has actually, over the last few years, that has increased. And that has also accounted for we seeing more patients. Now, people are now more aware that, okay, what this person is doing is not just an issue of that is who he is, but it seems that this is a mental health condition based on what I heard that doctor say on radio, based on what I heard that doctor say on the TV. This issue is not just an issue of this is his person. It looks like it's a mental health problem. So as a result of that, there seems to be an increased awareness. So that's on one side.
Okay.
But truly, there's also some increase in the, in mental health conditions generally, and various factors are responsible. Let's give, for example, where I work, Federal Neuro-Psychiatric Hospital, Yaba. Over the last 3-4 years, there has been an increase in number of admissions due to addiction-related problems.
Okay.
So many years ago, there used to be some empty beds when you get to the hospital. So maybe in a 40-bedded ward, for example, maybe you see 30, 35 patients. Now, the 40-bedded wards are full, every time. And over half of it, many times, drug cases, marijuana use, and alcohol use, pentazocine use. So obviously, the increase in drug of abuse that we have in the environment also led to increase in mental health conditions.
Okay.
That's one. Another thing that is that there's a reduction in the social support that we have now. The family network cannot be compared to what used to be 30, 40 years ago. So now women deliver and you are the only one in Lagos. Your whole family is in Ekiti. But you came to Lagos, you and your husband, to work and then try to work hard, make ends meet. And in fact, now your mother-in-law is also a busy principal, in a secondary school. Your mother herself is a banker, so it's difficult for her to take leave and say she's coming, to stay with her daughter-in-law for the next 2-3 months. But during the period of our parents, our grandparents, when one person delivers, the whole community has delivered.
Yeah.
So there's also that issue. Now people are relocating, and your friends, your family, they are not there to support you. You can imagine what happened last year during COVID. There was an increase in the number of mental health conditions along reported across different spheres. So, for example, there was lockdown. People were, human beings are social beings, but as a result of the separation, the isolation, some people could not just, take it anymore. And there was some form of, depression, some people anxiety. So definitely there are a lot of factors that has made mental illnesses more pronounced, and of course, like I said, more obvious now because people are aware.
Now, there's something that you said that I was listening that that rang a bell for me again. I used that word. You said people are more aware of mental health situations now. There's a lot of awareness. So sometimes when someone says, okay, in the past you say, I'm like this, I'm like that. And now people are now knowing, no, even if I'm like this, it could be that there could be something to it than me just being like that. So people are, checking themselves to see. But then I want to ask you this question, right? What's the difference between emotional health and mental health?
I mean, thank you for asking that question, because I was going to draw you back a little when we're using interchangeably mental illness and mental health.
Okay, please help me.
Okay, all right. So mental health is a state of well-being.
Okay.
Whereby the individual is able to realize his or her own abilities.
Okay.
Is able to, work productively, cope with the normal stresses of life, is able to contribute to his or her own community. That is mental health. I mean, it's supposed to be mental wellness, mental well-being is a state of well-being. Now, there is nobody has perfect mental health,
Okay.
But the opposite, in a sense, is mental disorder. That's on the other end of the spectrum. Now, it's possible for one not to have a mental disorder yet, but you also don't have optimal mental health.
Okay.
Let me give a scenario. Somebody who just, lost his job, is not going to be the happiest person on earth, but that does not mean the person is depressed yet.
Okay.
You've not been able to sleep for the past few days and you're just cranky, because you have a lot of deadlines to meet, and they are just cranky. Now, that is not a mental illness. Okay. It's not a mental disorder, but it does, obviously, you are also not operating with,
optimum mental health.
Are you getting me, ma'am?
I'm getting it, yeah.
Okay, so now, you asked what is emotional health. Now, many times we use emotional health, psychological health, and mental health, interchangeably. Because sometimes, people have mistakenly associated mental health to mean mental illness.
Exactly.
So sometimes as a result, you see us using words like psychological health, emotional health, just to describe, the state of well-being of a person as regards the person's mind, not physical health now, but as regards the person's mind. Now when we are talking about mental disorders can actually, be problems of thoughts, problems of emotions, problems of behavior, that is a deviation from what is the acceptable norm and has affected the person's level of functioning. What do I mean by level of functioning? Normally, people take care of their hygiene, they sleep well, they eat well, but as a result of some, emotional problems, that level of functioning can be affected. Another level of functioning apart from personal is family functioning. Sometimes maybe something happened and you are not happy because maybe your favorite football club lost a match. So it's okay. I mean, but by the time this unhappiness, is leading you not to go to work, then it has affected your occupational functioning. By the time normally you wake up 6 a.m. to maybe cook for your family, but because you are not too happy, you don't wake up at 6 a.m. You wake up at 8:30. Your children are even late for school. that has affected your family functioning. And there's a third one that we talk about the broader social context, the community level. Okay. Maybe you are the choir mistress in church, but you don't just want to go for choir rehearsals today. Sometimes they're not just feeling up to it, and you decide, but you drag yourself and go. But you can imagine if your church is supposed to have a presentation tomorrow, maybe because you're expecting maybe the general overseer and everybody is waiting on you. But just because you are not happy, you are not able to drag yourself out of bed to go to church that day. So that emotional issue has affected your functioning even within the community.
Okay.
So that is what differentiates a mental illness and from normal mental health.
Okay, so there is a difference between the mental illness, then there is the mental health, and then also our emotional health can also sometimes interface with our ability to function mentally at an optimal level.
Yes.
Yeah. Okay.
Yes.
So yeah. So that brings me to the next question. What's then the difference between, or rather, let me put it this way. So somebody, is not happy that he lost a job, or is not happy that probably his football team didn't win the match or something like that. And then it now begins to affect his functioning. So how does that anxiety or worry or sadness, how does that now creep into depression?
Okay. So, since you brought up depression, let's start with depression first.
Okay.
And it's completely normal for your mood to, change depending on circumstances.
Okay.
It would be ridiculous for you to hear, for example, that your, best friend had an accident, and you say, "Whoa, wow, wonderful," and you start laughing. We'll be worried, But so when you hear some news that's not too appealing, you can be sad. But when does it, or maybe somebody fails an exam, you can be sad. When it becomes depression, is when this sadness colors everything that you do, such that even in the face of good news, you are still not happy within you. This sadness is there throughout the day, or almost throughout the day. Before you know it, we have, depression usually does not come alone. Sadness rather, that we talk when we mention clinical depression, that sadness does not come alone. It comes with brothers and sisters. So, for example, the person gets tired easily. Just little activity, you get tired. There's a loss of interest in the things that you normally enjoy doing. Usually, or sometimes the sleep can be affected. So we have people who, as a result, they don't sleep because of depression. They could sleep, wake up at 1 a.m. and they're on the bed just tossing. They keep worrying about, how their life is not going on well, Or some of them could actually sleep all day rather than, having poor sleep. In the same vein, some people lose appetite, while some will begin to eat and eat. There will be a change in their appetite. For people who have maybe regular sex, there's loss of libido. They are not just interested in anything like that. Some people become, start feeling guilty. I like to use this example of elderly women that have had depression, but have been killed by the community because this woman comes out saying that she wants to confess that I killed this person, I killed that person. Meanwhile, the woman is just depressed. She didn't kill anybody. Her saving grace would be if the person that she mentioned that she killed is actually alive. People say, this person does not do anything. No. You see people, you just start magnifying bad things. What do I mean by that? Somebody fails one exam and he says, I'm a failure. That is, magnifying bad things. When good things happen to the person minimizes it. So maybe, for example, the person, you're not feeling too happy, you think you may be depressed, and then maybe your husband does something nice to you, maybe, and you just say, oh, no, it doesn't really matter. So the person minimizes good things when it comes, maximizes bad things. At that point, it's tending towards clinical depression. Sometimes people begin to feel worthless. I'm not just good enough. They begin to feel hopeless and helpless. And many times that's what leads to suicidality. Desire to kill self, just to end it all, to escape, this feeling that they're having. They just feel like, maybe I'm worthless. I'm not good enough. And sometimes, suicidal thoughts start coming to them. Some people, apart from suicidal thoughts, could actually hear voices. And at that point, of course, it's very severe. So they're hearing voices of people who are not there. Those voices will now compound the issue. So depression, when it's not treated early, can actually lead to, severe depression with psychosis, where the person now begins to hear voices that maybe are not good enough. The voices can mock the person. You can imagine somebody who's already depressed and is hearing voices saying that, you're a nobody, you're not good enough. By the time you hear people start vocalizing things like that, that I'm not just good enough, low self-esteem, poor concentration, and there is no way at that level it will affect their functioning. Because someone who, is feeling tired without even doing anything, that's not the kind of person that is going to work. That's not the kind of person that will be, cooking or doing dishes. No. So by the time sadness begins to affect your daily life, then definitely is already entering towards depression. It could be mild depression, it could be moderate, it could be severe, but any form of sadness that's already affecting your activities, level of activities, going on for more than 2 weeks, should be checked out.
Okay. Listen, I'm writing all the things you're saying, right? For more than 2 weeks. Now, so this is what I get as a lay person, as an ordinary person.
Yeah.
So you're saying to us, for people who are listening, even for me, that it's okay to be sad. Sometimes as teenagers are very, if you're parent to teenagers, sometimes they're moody. So it's okay sometimes to have those sad and moody. If you have something that is unpleasant, you're sad, But where it begins to become something to worry about is, if I have to use your words, where the sadness begins to color every aspect of your life. So for example, if something bad happens, you maximize it, you magnify it, and then if something good happens, you minimize it. So for example, if you pass an exam, you're like, So it's all these little subtle signs of depression. And you said the depression comes with brothers and sisters. So for example, you could feel tired, you could have loss of interest in even the things that you want to do, sleep disorder, you could sleep longer or lesser, appetite change, you could eat more or eat less, change in libido, you feel worthless, hopeless, helpless, and then you hear voices and all of that, which with that now becomes, it taking it to the next level. So people can be mildly, moderately, or severely depressed. That is.
Yes.
So how would I know, for example, if I'm depressed? Can I know if I'm depressed? Can someone know if they are depressed?
Yes. So depression is one of the mental illnesses that people recognize when it's happening to them. Okay. So internally your state of mind. What it means when you were happy. So I ask people, say, when last were you truly happy? And they will tell you, let me not lie to you, for the past 6 months, I've been sad. Let me not lie, since that incident happened, I've been sad. So people recognize when they are depressed. Others may not until they begin to see some signs. But individual people recognize. What do I mean by that? So, for example, some people are not happy at all, but nobody knows that they're not sleeping well because they sleep alone in the room.
Yeah.
They live alone. Nobody knows that their appetite is poor. But the person knows that I don't feel like eating. Are you with me? So definitely that awareness campaign, like what I'm doing now, what we are doing now, what it does is that it now, makes you know that, okay, really what has been happening to me, which I recognize is depression. So you begin to recognize that, okay, this feeling of sadness is not normal, but what makes relatives notice that their people are depressed is when they say that this person is withdrawn.
Okay.
When they see that this person is, complaining of tiredness, repeated tiredness. If they are lucky enough, to live with the person and they're not, you are sleeping all day. When there is a change in the behavioral pattern of this person. But usually, before relatives recognize that, it's already getting towards moderate or severe. The funny thing is that for children and adolescents, most of the time when they are depressed, rather than withdrawing, they tend to be irritable. They tend to be cranky. For adults, they are the ones who withdraw. Adults will internalize the depression. Children mostly externalize the depression. A child, the teachers will just notice that for the past 1 month thereabout, you that you used to just sit calmly in class as you interact with students, now you are fighting. Why? Why are you fighting? This was not you. And then maybe that's when he's able to confine the teacher and say that maybe there was some form of sexual abuse. Maybe my parents are always fighting at home. There's domestic violence, and then so he now begins to just get irritable unnecessarily, begins to fight in school. They too have problems with sleep and appetite. As well, the adolescent child who used to eat, he's just not asking for the food. He's not just asking for the food, he's not interested in eating. Sometimes you hear them say things that a child who used to have dreams, they're asking, so what do you want to be? And he says something like, there's nothing for me in this world. And you wonder, why did you say that? So the best way to recognize depression in a child or an adolescent is a change in behavioral pattern that is lasting for 2 weeks. For what it's worth, you want to call that child and say, is there anything you want to tell me? So you know that some children are quite naughty. They've been naughty since childhood. Playful, So I'm not talking about things like that. So a playful child, and then it suddenly becomes withdrawn. So you should be concerned. Okay. But more commonly in children, they tend to externalize rather than internalize depression.
Okay. Now I just want to check if I have any questions in YouTube or let me see. So guests, please, my viewers, please feel free to leave your questions or comments in the comment box below. If you're watching via Zoom and if you're watching via YouTube, please leave your comments below in the comment box and my guest will answer the questions. Doctor, but there's some people who are always bubbly. They are very happy, very excited. When they go out, they make things happen. But then they come home and they are sad. So sometimes, is it possible that those very happy people are sometimes the most depressed as well?
Oh, well, so I won't say most depressed, but I would say that whether someone has a bubbly personality or a relatively calm personality, they can be depressed. Anyone, I mean, there are factors that, sometimes lead to depression, but I mean, it's funny that some people don't say their minds. They have the, so they have the potential to hide depression. We even call the particular category smiling depression. Now, that's not as common. Most of the time, depression colors the whole person's, whether at home or outside the home setting. Most of the time, depression colors the person's, behavior, and emotions. But like you said, there's this group of people, who only those who are closest to them, maybe the husband, maybe the brother, knows that, but I saw you crying yesterday. When I woke up, I noticed that you were not sleeping. So we're able to catch those signals. Say, yes, truly, there's this joke now that before, pastors used to be the most, they were used to be the ones that counseled people the most, but now Uber drivers have also become counselors. So you see people going to parties, and on their way back, the Uber driver is a counselor, because the person can break down in the vehicle, and start weeping, and things like that. So indeed, it can happen, but the closest people, are the ones that should be able to recognize signs and symptoms of depression.
Okay. Doctor, let me just take this question from someone. Someone says here, do you think that mobile phones and social media accounts for the increase in depression among our youths and even adults?
Okay. So phones are vehicles. It is what you put in the vehicle, that will determine what comes out. So same with social media accounts. So you can imagine people who get maybe intimidated. People who get intimidated by their friends. Now with social media, I can see my friend in the US and get intimidated. Before, it's only when we go to parties that I get intimidated by these friends. But now I can be at home and the intimidation meets me at home. So, that is how social media works. So it's a vehicle. So social media itself does not increase depression, but it just, makes you have access, to those things which might have, caused depression with or without social media.
Okay. So where do we go for help? Because like I told you before, I said I was in contact with a guy yesterday, and he talks about the fact that there's a lot of stigmatization that goes around, all these kind of things. So yes. How would somebody openly say, I don't feel good, there's something wrong with me?
All right. So talking about stigma. I'm sorry. So talking about stigma, indeed, the stigma is still there. All over the world, actually, not just in Africa, even though, it's worse in Africa, the stigma is still there. However, over the past few years, people have been coming out more and more. I'll give an example. During this Olympics, one of the biggest Olympians ever, stepped down after the first event and said, I can't do this. Said, because I'm trying to protect my mental health. And, she said it to the whole world. A few days later, we found out that, she had been battling depression, and then after the Olympics, we found out that, her aunt died during the Olympics, and that compounded, the issues that she was already having with depression. But she came out and told us, that was Simon Biles. Not only her, months ago, Naomi Osaka did the same thing, and there are footballers, sportsmen and women that are doing the same. And the more people are able to come out and say things like that, the less stigmatizing mental health conditions will be. So that's being said, the best places to actually go for help are with professionals. On social media now, we actually have a few, NGOs, organizations that are very, loud on social media, that people just slide into their DMs and ask questions. I mean, I've had patients from Mani, mentally aware, I think Nigeria Initiative. I've had patients from She Rights Woman, from different NGOs that are very, loud on social media. And so they are in a sense, the interface between the professionals and the clients. So if you just Google these people, they could lead you aright. But apart from that, there are also hospitals that you can. So many people are scared of the hospital I work in. It's one of the biggest.
The hospital in Yaba.
In Yaba, yes, people are scared of and truly, it's actually a calm place. It's a calm place. I'm sure people have the image that
I've been there a few times.
Oh, okay. Okay, that's good. I'm sure some people have the image that when you get inside Yaba, you see naked people running up and down and all that. I mean, that's not true. So you can actually reach out to us too. I've had people come in with problems of addiction, problems with sleep, and no psychosis whatsoever. So the funny thing is that, if you just feel like you're not good enough, I'm not feeling good, you can seek help.
Okay. Now that brings me, I said to you that I've been there a few times. I went with someone, Okay. So one of the things that, like you talked about the hospital in Yaba, the psychiatric hospital in Yaba. And, sometimes, when you say to somebody that you went there or you took somebody there, there is this kind of like, what is it? You mean, so there's this kind of, like you said, people are scared. So from my experience going there, because we've had experiences where we had to refer people there. You don't have to have a psychotic condition to go there. You could have, like you said, disorders, maybe sleep, maybe, even emotional, or maybe you're not feeling as well as you ought to. And then you just pop in there to talk to an expert that would help you, Yeah?
Yes.
So
yes, you're right.
Don't be afraid of going to Yaba.
No. Don't be afraid. So, I mean, we have psychologists, we have social workers, we work in teams. And, if depending on, what the condition is, you might just need to see a psychologist and then we help you through. We help you through the condition. Yeah.
Okay. So I was going to ask this question, it slipped my mind. So which gender is most affected or presents more of mental health lack of optimal functioning more?
So, all right. So it depends on the condition exactly. So, for example, psychosis is ratio 1-to-1, same in male and female. But depression, anxiety are more common in females, than males.
Okay.
Scientifically. So, eating disorders, are also a little more common in females. Sleep disorder can occur in male and female, ratio 1-to-1. So it depends. Addiction, is more common in males, but that also depends on what they are addicted to specifically. But it's more common generally in males. So it depends on which condition exactly we're talking about.
Okay, so depression is more common in women. Anxiety, worry, because we worry about our children, we worry about, you have like 10 children and you worry about 10 of them, and you spread yourself thin.
Well, although people argue that because the men don't come out and say they are depressed, and that may actually be the reason why we see more female patients. But why that is true on one hand, severe depression cannot really be hidden, whether you're male or female. So if it is mild, yes, with some form of psychotherapy, some form of therapy, maybe even by friends, pastors. If with mild depression, you can come out of it. But when it gets to severe, it doesn't discriminate whether male or female. But despite that, it's still more common in females.
Okay, because we worry a lot. So,
Yeah.
is fits of anger a sign of depression?
Okay, now
rage in men.
So usually no. But once again, if this is a change in behavior, so some people have problems with anger. They've had it for the past 25 years. They've had it for the past, since they were young. So that is something else entirely, is not depression. But you can imagine a calm person, never been angry before. Over the past 3 weeks, he's been unnecessarily irritable. It can be a sign of depression, it can be a sign of anxiety, or even any other mental health condition. Because that is a change in his previous behavioral pattern.
So for people who are watching, for example, so if you or you notice that someone that you know has a change in behavioral patterns, then that could be an indication that the person is going through, it could be mild or moderate or high depression. Yeah. And that means the person is clinically depressed. Yeah.
Yes.
Okay. Now, the topic for today, we flogged in a lot, is learning how to look after our mental health. How? Because like in Nigeria, and we always say this about ourselves, Nigeria, depression not for Nigeria. Like, this Timaya song, I can't kill myself. They said that song is an antidepressant. I believe it. This life, I can't. So anytime my head wants to spark, I just play that song. I say, this life, I can't kill myself. Allow me to flex, because I was reading through, watching this YouTube, and people said that this song is an antidepressant. So we pride ourselves in saying that our more Nigerians don't get depressed. But there is a rise in the case of depression and all that. So how do we begin to look after our mental health? What are the simple things we can do? Is going to the bar, drinking, does it help? Socializing?
All right. So socializing, definitely helps with your mental health. Remember I mentioned that human beings are social beings. And that was why during the COVID pandemic, where there was a lockdown, people broke down.
Yeah.
So definitely, socialize. Now, socializing doesn't necessarily mean that you go to the bar to drink. It means that you are interacting with your friends. So you have some people who you work from 6 a.m. to 11 p.m. That's a recipe for disaster.
Okay.
If you do that Monday to Sunday, there's no time for you to just be with your family, be with your friends, have fun, hang out. That's a recipe for disaster. So some people just burn out as a result. From getting burnt out, you can get depressed. From chronic fatigue, you can get depressed. Even if you don't get depressed, you are not going to be operating at the maximum optimal mental health. So of course, socializing is important. Exercise is good. Exercise is important. Sleep. So, God created us in such a way that 1/3 of our time on earth should be spent sleeping.
You hear some big men say, look, I spent that when you sleep for up to 6 hours. I've heard people say it. You're wasting your life sleeping. Sleep is a sign of laziness. What hours when you sleep? Some people even give us arithmetic that when you sleep for X number of hours, that you slept your life.
So I laugh. I laugh when I hear things like that. So you are supposed to sleep between 6 to 8 hours per day. And if you sleep between 6 to 8 hours, that means you are sleeping 1/3 or to 1/4 of each day asleep. Now, the fact is that the brain performs numerous functions. One of it is memory consolidation. it helps to consolidate. That's why you see many people that prepare for exams by crash reading, and then you don't sleep for the last 1 week of the exam. You can get on time and just blank out, because there's problem with memory consolidation. For some others, they even develop psychosis, because there's sleep deprivation. So there's energy conservation, there's restoration, which happens with sleep. So the best functioning people, are those who sleep between 6 to 8 hours. If you sleep longer than that, that means you're sleeping 9-10 hours per day. Research has shown that you is likely for you to be an underachiever, and underachieving also takes its toll on your emotional health. And if you also sleep less than 6 hours per day, so it will tell on your physical health or mental health or both.
So when is the best time to sleep? Is it 8 o'clock to when?
All right, so the best time to sleep is anytime at night, where you get your 6 to 8 hours. So whether you want to sleep 10 p.m. to 6 a.m., whether you want to sleep, 11 a.m. to 5, that's the best time. But, as much as possible, 1 a.m., 2 a.m. should meet you in bed sleeping. Sometimes, you have things to do around that time.
Yes.
So for example, you could be a medical doctor who's on night duty. You could be a nurse, who's on night duty. So that's why it is as much as possible. It's not 100%, but as much as possible, around that time it should be. That's why, okay, if you notice, if you are awake 1 p.m., you may not have any headache. It's normal. But if you are awake 1 a.m., you discover that many times you could be, struggling to concentrate. Once again, this has to do with, for most people, there are a few people, who their biological clock, their circadian reading, has been adjusted in such a way, that they can get away with some of these things.
But it's not everyone. But let me take this question. Someone is saying, can people fully recover from depression or psychosis for witchcraft and stuff like that?
Okay. What do you say about witchcraft? I didn't get that.
Hold on to that question. Let me ask you one question before you try to answer this. In those days in the village, I don't know if it happens again now, but the elders used to say, and I used to hear them say it. They say that noonday, when the sun is in its fullest strength, is a very dangerous time, because people are most likely to trip, right? So they associated sometimes, particular times of the day to when mental situations can be, worsened. And also witchcraft as well. Also witchcraft.
Okay. Yeah. So, all these, were all explanations, possible. When you don't know what causes something, you tend to want to look for possible explanations, for it. And that's why all these different theories came to be. At a point when people had, you see, so in some families, say they don't live till 40. At 40, like everybody dies, or before they clock 40. But now and more, we are realizing that some of those families are families whereby, they have systemic hypertension, high blood pressure from the age of 25. Nobody knew in the family. Okay. They didn't use drugs. And of course, the person just has a cardiac arrest one day. And because it is genetic, high blood pressure, that continues to run in the family. It's very similar explanation for sickle cell disease children, whereby they say that they call it abiku, because the child dies after, a few years or a few weeks or a few months, and they say that, oh, there's a problem with the family. The same thing with tuberculosis. Tuberculosis used to be a death sentence. When it happens to someone, definitely the person is going to die. But now there are, medications, for it. So because people do not understand the origin of mental illness, you have to explain it in one way or the other. And that's what has led to, this possible, all these different explanations. You know what I tell my patients when they come and or the relatives when they come and say that they think that this is as a result, this is a spiritual illness, So I tell them that if it were a spiritual illness, when you come here on Monday, you will see Pastor E. Adiboye. On Tuesday, you will see W.F. Kumuyi. On Wednesday, you will see a sheikh. On Thursday, maybe you see another imam, But instead, you are coming here, you are seeing doctors, and the government is paying us because when patients come, they get well. If not, it should have been tantamount to pouring water inside baskets. And no government will keep funding, a specialty if we're just, mixing things and then hoping that it will work. So.
Okay.
Okay.
Well, so would you answer this question? Can people fully recover from depression and psychosis?
All right. So can people fully recover from depression? The answer is yes. People can. In fact, depending on depending on the rate of recurrence of the depression. Some people have depression only once because something led to it. There was a terrible financial setback and the person became depressed. After treatment, the person bounces back. No problem at all. So depression, yes. Psychosis. Most people with psychosis, also recover. Some recover without need for treatment again. Most, however, recover with continuous need for treatment.
So they have to take the constant medication. That's why they say that,
yes,
that it is an illness.
Yes. So, just like high blood pressure, when people take medications for 80 years, 40 years, 50 years, diabetes, same thing, For some people with psychosis, they have to use the medications for many years too, like that. But there are a few psychotic conditions, there are some where, after months, the person is okay and don't need to go back to it again.
Okay, fantastic. I was just watching something just yesterday, and they were talking about even just going outside for a walk can help you with your mental health. Is that true? Looking at nature and walking in the mountains and just looking at outside of the window can help with mental health condition. It can help to ease your mind.
Yes. So I was going to say it won't help with a diagnosed mental health condition already, but it will help your emotional health. So that's what the concept of mindfulness, concept of meditation, of relaxation, taking your mind off things, be sure of analyzing what exactly is going on in my mind, and that's why we talk about, exercise, taking strolls. That's why I said that, if you are working 6 p.m. to 11 p.m. is a recipe for disaster, because if you are doing that every day, there's no time for you to just, unwind, make sure that there's nothing on your mind, just want to enjoy the atmosphere, want to enjoy the breeze, you want to meditate, take some time to just meditate, relax, and do some exercises. Yes, it can help your emotional health.
Now, quickly before we go, I just want us to talk about mindfulness because you're a mindful expert. So there's somebody watching me today and they want to learn the art of mindfulness because it also helps with improving our mental health. So what do we do? Quick tips.
All right. So first is you need to take some time off to be alone.
Okay.
So you are alone. Then you want to, when you are alone, you also want to make sure you are alone. What do I mean? So because sometimes you can be alone sitting down and your mind is going from roaming around. So you want to tell yourself, okay, stop. What are you thinking about? What am I thinking about? So when you decide what you're thinking about, when you know what you're thinking about, you can pin it down. You can even decide what you want to think about, at that particular point. Okay, I want to think about, some beautiful things, just meditate on those things, think about it. Then you want to, relax. There are some breathing exercises that you can check, relaxation techniques on YouTube.
I think give examples.
All right, so you can just take in put one hand on your tummy, one on your chest like this, and then you take in a very deep breath for about 3 seconds. you hold it, and then takes about 3 seconds to release it also. So you are doing that cycle, about, we say up to 10 times. Because of time, some people do just 5 times, but at least do it, that same cycle, so you relax, and then you can now, begin to meditate on, beautiful things. If some people, who are maybe Christians, you can try to use that time to meditate on maybe God's promises for you, good things. And so at least that can be the first stage of mindfulness.
Fantastic. Doctor, our time is fast spent. And so I thoroughly enjoyed this conversation, but unfortunately, we are not able to do justice as I wanted to do, because, initially when we were having the conversation before, you said it could take up to 3-4 hours for us to talk about mental health, and we can't even scratch the surface. So I believe that we learned a lot. We learned the importance of social relationships, in helping us to thrive mentally. And we've also seen that there's a rise in mental health conditions because of drug abuse, substance abuse. It could be alcohol and stuff like that. So just quickly, someone says here, let's check out this comment quickly. Thank you, doctor, so much. Please, is there a way we can get in touch with you personally for further details or consultation?
All right, so you could just go to any social media platform and just type in my name, Tiwatayo Lasebikan, just like it's showing on the screen. So I use my name on all platforms, and then my handles will come out.
Fantastic. So somebody on YouTube says, very informative topic. Thanks, Ibi and Dr. Tiwatayo. And guys, if this is your first time of watching me on being on this program today, I want to say a huge thank you. And for those of you returning, I want to say a huge thank you. And if you haven't subscribed to my YouTube channel, please do. It's Ibi. If you're watching and you haven't subscribed, please subscribe. And doctor, please subscribe to my YouTube channel. So guys, next week I have a guest whom I would call a word specialist. Again, it's all part of the self-actualization process. Would help you to actualize yourself through the use of words. Doctor, I am appreciative that you came today, and thank you all for being part of this program. I appreciate it, and see you again next week. Doctor,
bye. Yeah. All right. Thank you.
So bye, everyone.